Welcome back to the Dental Studios YouTube channel. Today I'm going to be talking to you guys about bleeding gums. Now, if you are getting blood when you're spitting out, this is probably due to your gums being a lot weaker. Unless you have got some underlying conditions like diabetes, for example, or you're on specific medication that makes your gums weaker, your gums should not bleed. It's not normal to have blood when you spit out unless you are a vampire. Gums that have no plaque on them generally will not bleed unless they are traumatized. So if you're brushing too hard or you accidentally hit your brush on your gum, or sometimes when you're eating you bite into a really sharp crisp, it's really sore. That can cause a bit of bleeding and it can last for a couple of days. Sometimes an ulcer can cause bleeding. If you're prone to ulcers, you may find that these ulcers bleed from time to time. Gum disease is the thinning of your gums amongst other things, and it's that thinning of your gums that causes them to bleed easily. When you're brushing your teeth, you're trying to get rid of all the plaque, that's the germs on your teeth. If you leave some plaque behind, this plaque then attacks the surface of your gums, making it a lot thinner. As your gum gets thinner, it is more liable to bleed, not only when you're brushing, but also when you're eating, and sometimes just at rest. So when your gums are bleeding, if it's not any of these underlying conditions, then what you must do is visit your dentist and they can advise you how best to brush your teeth. Visiting your hygienist will also help eliminate bleeding gums. If you manage to remove all the plaque from your teeth over a period of 4 or 5 consecutive days, you will notice the bleeding go down significantly. There's also very good mouthwashes, medicated mouthwashes on the market that you can buy over the counter at the pharmacy or a supermarket. For example, Corsidil, the brand name for chlorhexidine gluconate, and also Pyroxal. Both of these mouthwashes will work in conjunction with good toothbrushing to ensure that your gums stay healthy. To treat your bleeding gums, make sure there's nothing in your history, your medical history, that could be causing the bleeding. Ensure that you're brushing thoroughly. Bleeding gums can lead to more problems in the future. For example, your gums can start shrinking. If your gums start shrinking, they start exposing parts of your roots. And the root of the tooth is very sensitive, so when you're brushing that part, or you're drinking something cold, or maybe eating ice cream, I must be honest with you, I do like a Magnum ice cream. That part will get really sensitive and it'll send a sharp shooting pain down that tooth. So as well as receding gums, that can lead to spaces forming in between your teeth, and these spaces will trap more food and will lead to more problems such as bone loss and tooth mobility. So bleeding gums is a warning sign that things are not right. Clean gums are healthy gums. If you have any questions, please leave them in the comments below, and remember to subscribe and like our video.